I think from the very start, I always wanted to be very independent about my own care. So I liked going to my own appointments. Even in school, I was happy to take care of the school aspect of diabetes as well. So when I came home from the clinic, they'd be anxious and they wanted to know how you get on. What did the doctor say, and was he happy with your results, and how's everything going? And so when things were in good control, I was happy to say how great I was. But I suppose if the A1C has slipped, or if something wasn't right, or if they weren't happy with something, and it could cause a bit of friction. So you'd be very selective in what you want to tell your parents. It has caused arguments, like the blood results have come back and they're like, well, what's changed? But I think for other people going to clinics, if the parents, it would be brilliant just to feel very open about talking about it afterwards. I think I would have loved to have gone into my appointment and then go off for lunch with someone and then openly talk about it, talk about either whether things came back, if the results came back a little bit worse than what they were, but to be able to openly talk to somebody about it, especially with a parent, it would be a good thing. Yeah.
From a child perspective, I'd probably tell them to back off, a small bit, give them the space and room they need to develop. But I suppose from another perspective, you might say, just keep an eye on it, but don't be too involved. I mean, I'm sure the parents will want to stay involved, but I think, growing up sometimes, so gonna have to let it go.
Well, it's true, Mommy's definitely right for making me do the simple things by myself, because my medication's important and I should be on top of it all the time, whereas it's not just about seeing the doctors. So I would advise them to let them do it themselves. Like, I did want to see the doctors myself. I just wish I was more prepared when I began, but I'm okay now, so I'm content with that. But there is a point where they just have to do it themselves. Even if they don't understand, you just have to jump straight into it, because I'm going to be dealing with it for the rest of my life, and my parents can't have any control over that. So just let them go and do it, and if they're stuck, they'll come back. I just ask my parents stuff when I don't know it anyway, and they're happy to help. So
my first appointment, I was with my mum, and the doctor would ask me a question, and me and my mum at the same time would go to answer him. So I'd have to say, stop it. They want to talk, they want to listen to me, because that's what I was told as well in the transition clinic. Not the transition clinic, before, when I met them in August in Crumlin, I was told that they said, we're here to talk to you, not to your parents. So if you don't want your parents in the room, they don't have to be. And we sometimes try to encourage to detach your parents from it, just so you can have, there'll be times you want to just talk to the doctor privately and they want you to feel comfortable. So that first appointment, and me and my mum were both going to answer the doctor at the same time, and it did take some getting used to. And I think as well, there was one time when I was in hospital, it was my first admission, and I was going to get a PICC line in, and you need to have consent for that. The doctor comes and consents, and he asked my mum, he was like, do you mind stepping outside? I want to speak to Bevan by herself. And she's like, a big shock to her, because she never had that, because it was usually vice versa, where Bevan, you just step outside, I want to talk to your mum. And she just was totally taken back by that. So it does get it does take time to get used to it, but not she's fine now, and she just trusts that I'll tell her what the doctor says, which I will. Yeah. And same with my dad, they're if I'm in hospital, they'd come in, and one of them will come in to me every single day, and they'll be ringing me, how many times a day, have you seen the doctor yet? And no ma'am, it's 10 o'clock in the morning, or so they do eventually get used to it. And same with the home IVs and stuff like this. They're great now.